Today, Governor Cuomo named Monroe County on a list of 35 counties where health systems can resume providing elective treatments and procedures to their patients. We have received separate confirmation from New York State Department of Health. This is good news for several reasons. First, it means that our community has successfully flattened the curve and the risk of a dramatic surge in COVID-19 patients needing hospital care right now is low, assuming we continue with social distancing. This is a great testament to the people of Monroe County who continue to practice social distancing. It also shows the effectiveness of policies we have put in place to keep patients safe.
The state's guidance had been that there couldn't be more than 10 new hospitalizations for COVID-19 in the previous 10 days before elective surgeries could resume. That's not the case locally, in my understanding. So why is it? What do you think has changed, or what's your understanding of why it is that hospitals in Monroe County are allowed to open up?
Well, you correctly point out that that was one of the governor's criteria on his statement last week. That criteria has been removed from the two statements this week. Our opinion of that was that that was a thoughtful and helpful change, because that criteria did not account for population density in certain counties, nor did it account for stable overall COVID diagnoses. And because Monroe County has done such a noteworthy job of flattening the curve, we really felt that that criteria was not as applicable to us, and so we're pleased that criteria changed.
Thanks. I'll direct my follow-up then to Dr. Apostolakis. What is it that you are doing at the hospital level to ensure the safety of both patients and staff? I want to know if you're going to be testing people before they're admitted, either for antibodies or for the virus, and what other precautions you'll be taking.
So depending on what the procedure, what we're going to be doing for the patient, for any procedure or surgery where there'll be aerosolization, we will obtain RT-PCR swabs of the nasopharynx to rule out active disease. This is both for patient protection and for staff and faculty protection. As far as antibody testing goes, we're still a couple weeks away from getting antibodies. And once again, that's the utility of that is more about looking at the prevalence of the disease and whether someone may be immune or not. So acutely, and in healthcare settings, taking care of patients, it's less helpful.